On the radar today, the Kaduna State Internal Revenue Service generates 14.2 billion as internally generated revenue (IGR) between January and May 2018. This was made known by the Executive Chairman Mukhtar Ahmed in an interview with News Agency of Nigeria in Kaduna. Ahmed said the state has increased its IGR from an average of 800 million a month in 2015 to between 2.7 billion and 3 billion monthly in 2018. He further states that the 14.2 billion generated in 5 months is above the 11.5 million naira generated in the whole of 2015 and more than half of the 23 billion naira generated in 2016. Kaduna State Governor Nasir Ahmed El-Rufa'i visited the headquarters of LISCO in Helmond, Netherlands for advance meeting with the Chief Executive Officer David Suddens and his team to strengthen earlier discussion on setting up a LISCO textile park in Kaduna State. The step was taken as part of the state's effort to revive the textile cotton garment subsector in Nigeria. The state has in recent times attracted various investments due to the business-friendly environment put in place by the El-Rufa'i administration. The Minister for Budget and National Planning, Senator Udo Udoma, assures the people of Kaduna State of government's commitment to physical development. He made this known at the official commissioning and handing over of the Soil Erosion and Flooding Control Project in Kwai Town in Jaba local government of Kaduna State.
The approval of this project by Mr. President is a testimony to the present administration's promise that no part of the country will suffer any neglect.
To the glory of God and for the use of the good people of this community, I formally cut the tape.
The commissioning of the project today is a historic event, one that will go down in the memory not of the present generation, but generations that will come to benefit from the intervention. That this has been a great day, a great work by the federal government.
The election is something of a burden. It was a burden, but we thank God that God remember us through this present government, and they have come and wipe away our tears. God will bless them and lift them up.
We are thanking Buhari, and we are thanking our Excellency El-Rufa'i, because this work have made our community to look very nice.
I have told my children that in their generation, let him tell his colleagues or his friends that this regime has made us to be proud, because all these things they are doing for our children. So we are proud of this government.
Health is wealth. Everyone acknowledges this popular saying. Without healthy populace and workforce, the society will not function optimally and production will be affected negatively. Unfortunately, the health sector in Nigeria has over the years suffered serious neglect with immeasurable consequences on both individuals and the nation at large. Poor facilities, inadequate manpower, an absence of functional equipment, inadequate power supply, and many other infrastructural deficiencies have over time characterized the sector. Kaduna State was not left out of the infrastructural decay in the health sector. Kaduna State government, under the watch of Governor Nasir Ahmed El-Rufa'i, took a holistic view of the health sector in 2015 and realized that there is the need to take urgent steps at addressing some of the challenges in the sector. One area of urgent concern was the near absence of equipment in virtually all the general hospitals and primary healthcare centers in Kaduna State. The Kaduna State government began the reformation by ensuring the presence of a functional primary healthcare centers in the 255 political wards and 23 general hospitals across the state.
We've invested a lot of our efforts and resources in healthcare as well. The World Health Organization recommends that every state or country devotes at least 15% of its budget on healthcare. In the 2018 budget, we'll be able to cross that threshold at 16.1%, and Kaduna State has become an exemplar of the efforts to bring primary healthcare under our roof. And for that, we have support. We've received recognition from many agencies and received a lot of support from international development partners.
The government adopted the 1 PHC per ward strategy, meaning each political ward would have a primary health center that will be well-staffed, well-equipped with necessary commodities that will provide care to the people at the grassroots. Now, because 1 PHC per political ward was adopted, what it means therefore is that we need to, because most of them are in a very dilapidated state, so government decided to embark on expansion and renovation of 255 PHCs. In fact, slightly more than 255. As you know, we have 255 political wards. So this is what is ongoing. There's massive expansion and renovation of these 255 PHCs.
In collaboration with General Electric, the El-Rufa'i administration is now installing state-of-the-art hospital equipment across all health facilities in the state, especially in the area of maternal and child healthcare delivery. This is to ensure that general hospitals as well as primary healthcare centers in the most vulnerable communities across the state are upgraded and supplied with essential modern equipment.
All the primary healthcare centers, if they have issues beyond their capacity, the patients will move to the secondary healthcare facility. And because of that, even the secondary healthcare facilities, 23 have been identified, one per local government, whereby the referrals can be made to these secondary health centers from the primary health centers. So GE is equipping the 255 PHCs and also the 23 general hospitals that will be receiving referrals from the primary health centers. That is what is peculiar about the GE intervention or partnership with Kaduna State.
We have a partnership designed to strengthen the primary and referral care services and patient outcomes in Kaduna State. So we're looking at targeting the frontline levels of care, 255 PHCs, as well as the referral levels of care, 23 general hospitals. And it's all designed to address maternal and newborn health challenges, as well as heart disease challenges.
This intervention cuts across the 3 senatorial districts. Igabi local government area with headquarters in Turunku is one of the largest local government areas in the state and has been bedeviled by lack of equipment in the hospital, resulting to loss of lives. But that ugly narrative has changed as state-of-the-art hospital equipment have been installed at the Turunku Primary Healthcare Center.
So I'm here today to install equipment for the state governments. So we have several equipments behind me. We have the ultrasound system, we have the ECG, we have the resuscitator, we have the baby warmer, and we have the phototherapy.
Before this intervention, it has been a nightmare for both the health workers and the patients.
Before now, most of our ultrasound cases that we have to refer them to a long distance. So it's been causing a lot of traffic, it's been causing a lot of problems to patients in terms of going to do an ultrasound scan and coming back again with the diagnosis.
According to Dr. Abdurrahman Ibrahim, the supply of equipment wouldn't have come at a better time than now.
And we believe that this equipment will go a long way in reducing the maternal and neonatal deaths that we're having in the facility. The equipment are up to date. They are of a good technology. In fact, they are of recent trend I have barely even seen before.
Giwa Local Government Area Primary Healthcare Center also witnessed delivery and installation of new and modern hospital equipment. Hitherto, it has been difficult to carry out any major surgical procedure in the facility. The installation of the equipment will no doubt add value to the day-to-day operation of the center.
We are currently at General Hospital Giwa. So I came to install the equipment, a couple of equipments for them. That's equipment that have been previously purchased by the state governments. So we have a number of them. We have the ultrasound, we have the phototherapy, we have the resuscitator, we have the anesthetic machine. We have a couple of others too.
For now, anytime we have cases that require our patient to do an ultrasound, we have to refer those patients outside the four walls of our hospitals. They have to go, sometimes they travel long kilometers in order to ensure access to those services. But with the coming of all of these machines, it will actually make our work more effective as well as efficient.
In the southern part of Kaduna State, general hospitals and primary healthcare centers have also received various equipment that will help at enhancing major hospital operations. General Hospital Fadan Kagoma is one of the benefiting hospitals in the southern part of Kaduna.
Okay, so I'm currently at Fadan Kagoma General Hospital to install some equipments that were purchased by the Kaduna state governments. The equipment include an ultrasound system, a baby warmer, a phototherapy, a resuscitator, and an ECG machine.
The new equipment are going to be very, very helpful in that they are latest, they are more portable. We can even move some to other units that possibly we have patients that cannot move to where we want to examine them. We can move them to even where the patient is lying down, and then we could use that to do our diagnosis and then scan, find out what is wrong, and then prompt management will be executed.
Jabba local government has about 155,377 inhabitants. General Hospital Kwai has also suffered serious neglect over time, but was recently upgraded and equipped by the El-Rufa'i administration.
Truly speaking, this equipment actually came at the time that I needed most, and truly it's actually a surprise. Because over time, since the inception of this hospital in 1974, we have never had this kind of equipment. And truly, as we actually have them now, it's going to ease our work and also going to make life easy for our patients.
We are teaching them how to use the machine because this is a new advance in the utilization of machines, because the technique we were using here in the hospital was only intravenous anesthesia, but by the use of the machine, the Care Station 30, we can now have an upgrade, an update to inhalational anesthesia too with monitoring.
In fact, before this time, we were having challenges about anesthesia machine, where we cannot do major operations without anesthesia machine. But now, with this present anesthesia machine, we can equally do surgeries with ease.
This training has been very fruitful because this is the very first time we are having a government that is supplying these sorts of equipments to our various hospitals. It is something that will go a long way to improve our practice in our hospital.
What is CADSTEP? CADSTEP means the Kaduna Startup Entrepreneurship Program. So the whole idea is that all these young people can be brought together, trained, and converted into useful human beings. CADSTEP was the initiative of the government of Kaduna State, the Bank of Industry, and Kaduna Business School. It initially started as an intervention that was designed to solve critical problems in the area of unemployment. The administration of Malam Nasir El-Rufa'i came in 2015, and one of the first things that they were confronting with in terms of the youth was jobs, and that is how CADSTEP emerged. 2,500 people have passed through that program, and about 25% of them have accessed money from the Bank of Industry, and they've started different types of businesses, from schools business, fisheries, poultry, manufacturing, carpentry, soap making. So what we did was to take on the responsibility and be the mother of the arrangement, and we do, even where we're not asked. We take steps even where once we see the need, and then inform them. And so far we have received sufficient cooperation. Anytime we recognize an anomaly or speed of processing of loans, we quickly reach out to them, show them the challenges, and they respond very quickly. The government of Kaduna State has also been very, very supportive. We have to commend the administration of His Excellency Malam Nasir El-Rufa'i.
Generally, the Nasir Ahmed El-Rufa'i administration has continually strived to bring the best to the state in all the sectors of the economy. The health sector has witnessed great change in the area of equipment. Yusuf Dansoho Memorial Hospital is one of the famous hospitals in Kaduna metropolis, serving one of the most populated areas in Kaduna. Strategically located at Kaduna South local government, with proximity to both Kaduna North and Igabi local government areas, Yusuf Dansoho Memorial Hospital has over the years suffered neglect. Apart from the shortage in equipment, the hospital has suffered from epileptic power supply, hindering activities as well as endangering the lives of patients, especially those undergoing surgical procedures. Yusuf Dansoho Memorial Hospital, considering its proximity to the Sir Kashim Ibrahim House, which houses the governor, and its strategic location, coupled with the high number of people it serves, Governor Nasir Ahmed El-Rufa'i directed that the hospital be connected to the government house power supply. Now, Yusuf Dansoho Hospital has constant power supply.
His Excellency Malam Nasir El-Rufa'i has done a lot for this hospital. We are very grateful. And one of the most fundamental things that he has done, which is unique and peculiar, is about the power supply to this hospital, which is very remarkable. What he did is he connected the government house to this hospital, which means if the government house has light, we have light. If he's on his generator, he has generator. So Definitely in hospital, when you have light, it means you could do a lot of things much easier. The light is not just to the hospital, it's connected to the hospital, to the school, to the residents, and even to the dormitories. So people could testify that we have light almost, I could tell you, 24 hours.
Today, many of the patients patronizing Yusuf Dansoho Memorial Hospital have cause to be happy because of the attention given to them, especially when the case involves surgical procedures. Kaduna State has been witnessing increase in budgetary allocation to the health sector since 2016, and the overall performance is indeed encouraging. According to the Kaduna State Health Sector Budget Performance Scorecard developed from secondary analysis of the 2017 Appropriation Act, the total health budget as of January to December 2017 is 24,870 million. This is an increase of about 11.6% compared to previous years. Health capital budget is 10,490 million. This is an increase of about 42.2%. Health recurrent budget of 14,580 million. That is an increase of about 57.8%. In terms of performance, that is, funds released to the health sector, the El-Rufa'i-led administration has done pretty well. Considering the following statistics: percentage of health capital released in 2013 stood at 15.8%. Percentage of health capital released in 2014 was 3.21%. Upon assumption of office of Nasir Ahmed El-Rufa'i, the percentage of health capital released in 2015 increased by 17.56%. By 2016, the percentage of health capital released raised to 40.53%. Percentage of health capital released in 2017 was at 34.42%. The scorecard was presented at the Kaduna State Maternal, Newborn and Child Health Accountability Mechanism (KADMAM) in its first quarterly interactive forum to strategically influence actions that will promote transparency, accountability and utilization of health finances.
Everything has been centralized in such a way that you can properly manage primary healthcare in the state. Now, this is, if I will sum up what has been happening with primary healthcare system in Kaduna State, is that, look, the governor is building a resilient and sustainable system that will be able to deliver credible healthcare to the people. Any country that has a very good health system, check it out. They have a very good primary healthcare system. So Kaduna is already on the way to having a very sustainable healthcare system because we are fixing primary healthcare. Once we get it right, and we are getting it right, our health indices will improve, maternal mortality will reduce, under 5 mortality will reduce. And one key thing that government has done as a result of the revitalization of primary healthcare is strengthening routine immunization.
Public healthcare in Kaduna State has indeed received certain levels of interventions and improvement in service delivery. Efficient service delivery is key to any developmental stride. Where people will not only get value for their money, but also good and timely delivery, which in turn will satisfy individuals and society at large. However, people may have their views on what the government is doing and the kind of services that they have been receiving in recent times across public hospitals and primary healthcare centers.
Formerly, people don't patronize public hospital. But now that the government have improved the facility, people are coming in numbers, including us. We never knew we could be attended to this fast by the doctors. But here we are, happy with the service provided.
We were referred here from another hospital. We came here around 8 in the morning. Thank God, the medical personnel attended to us almost immediately.
Unlike before, there is high improvement in service delivery here. Patients are really happy with the public hospital. Even in private hospital, you can't get better. They have first-class equipment. Within a short time, we were attended to and provided with all the necessary medication.
We are grateful for all the attention given to us. They go around from time to time to administer drugs and other medical help. We are happy and grateful for all the assistance.
There is a great deal of improvement generally. I can't remember any power outage for more than a minute. When there is power outage, it is restored within minutes. We are being catered for as expected.
My sister was brought here as an emergency case. We thought we were going to lose her, but the surgical operation was done successfully, and we are very happy that she's healthy and good.
The development of human capital is number one of the 5 priority areas we identified in the restoration program, and we promised to invest aggressively in education, health, and social welfare. Nasir Ahmed, El-Rufa'i.